Okay, I think we will kick off, and the session's being recorded anyway, so people can watch it on playback if they'd like to. So welcome to today's Community Mental Health Transformation webinar. So I'm Alice. I work in the comms team at Sussex Partnership Foundation Trust, and I'll be your host today for today's session, and in which we're going to be talking about neighbourhood mental health teams, in particular the mobilisation of the teams across Sussex and a go live date. As we near the end of the year, we thought we'd take a moment just to reflect back on our neighbourhood mental health team journey so far and just recognise all the work that everyone's put in to get us to this point. I'll just admit someone. There we go. So yeah, let's get started. So before we do, I'll just run through some Teams tips so everyone can get the most out of the session. So as I say, it's being recorded and it will be added to our playlist on YouTube. But if you prefer, just keep your camera turned off and anonymise your name. To turn on live captions, click the three dots that say more in the toolbar of your screen, go to language and speech and then select turn on live captions, and there'll be time for kind of questions and answers during the presentation. And you can also kind of submit questions in the chat or just raise your virtual hand. We've got a great lineup of presenters, speakers today, really showing that neighbourhood mental health teams is a real system partnership piece of work. So we've got Penny and Martin, who are the leads for the programme from SPFT and the voluntary sector. And we've got Emma talking about West Sussex neighbourhood mental health team. So Emma from BHT Sussex. We've got Mark Mellin from Sussex Partnership talking about Brighton and Hove neighbourhood mental health teams, and he'll be joined by Dom Leslie, who's the team manager for the teams in South Down. And we've got Ian, Glenn and Ricky, who are representatives for East Sussex neighbourhood mental health team. So welcome and thank you all for coming along today. Okay, so to get started, I'd like to invite Penny and Martin to come in and just talk about neighbourhood mental health teams and the kind of formal go live for those teams.
Thanks, Alice. I think, apologies everyone, Martin and I haven't quite rehearsed who's going to present this first slide. So, Martin, should I kick off or would you like to?
Yeah, you go and I can just add Penny. Yeah, sorry.
Okay. No, it's been a bit of a hectic week, as I'm sure it has been for a lot of people. So thank you everybody for joining us. As people, or many people will be aware, we have been working on our programme alongside our new system, System 1, which is going to be operationalised for us in the coming months. And there's been a slight change to the timeline of the launch of System 1. And then following that, we were asked to really think about what we may need to do to see what parts of neighbourhood mental health teams we could progress with and what parts might be a little bit more tricky, and to see if, in essence, we can start that process of recognising that NMHTs have started to operationalise everywhere, in that the new meeting instructions have taken place. People have started to build relationships outside of their original team, so people are working together much more in a neighbourhood type of way, and that was kind of pitted against, I guess, the thought that there are some bits that we won't be able to do. For example, have a shared record, which we know nationally has been of great benefit, and we will get to that, of course, and being able to do things like jointly record performance and activity data. So we took a paper out to SPFT's governance, which is something called SIG, and to the programme board, the Community Transformation Programme Board, following consultation and discussion with leads in the three localities, so East Sussex, West Sussex and Brighton and Hove, to really ask that question: what should we do? Where should we go next? What does it mean? Because up till now, we have really kind of aligned together. Those two programmes have really aligned, and of course they do still align and will continue to do so. So we did that. Can I look at the next slide, please, Alice? I wonder if the next one. Is there another one or isn't?
No, it's just one
no,
slide.
okay, sorry, go back to that one. Sorry, I thought I had another one in there. Apologies, everybody. So we did that, and the agreement was made that yes, we could, but we would obviously have to make amendments to what Go Live looks like. fundamentally, we've described those things. So the things that we will be able to go ahead with are, as I've just discussed, the operationalization of the model. So working in that new way, having joint leadership, setting up those teams, having a much more of a multi-agency, multidisciplinary approach in each neighbourhood to working towards supporting people. And as I say, the things we can't do are the things around the shared record and information around the activity data in those new boundaries of the new teams. And the other thing that we are unable to do is fully operate the standard operating procedure for NMHTs as we'd had approved and signed off, because some parts of that obviously contain reference to System 1. So, but in all of that, the overwhelming response is we are already working in this way from an operational sense, and we want to continue, and we need to mark all of that work that's happened. So it was agreed that we will, in essence, and I think go live is an odd term and it can be tricky to really define, but we will recognise ourselves as formally live from the 8th of December in terms of operations and how we're starting to deliver that model. We are putting together some comms, which Alice is putting together for us to make sure that's crystal clear to everybody using our services, to all of the stakeholders, including primary care, about what that really means. So at the moment, what it does mean is that we are starting to work in this new way. We're starting to really pull together as a whole system. And that is really the change at this point. And we continue to work towards, as I say, having the new EPR with us, so we can have that shared record, so we can look at performance data, so we could do some other bits and pieces, so we can roll out our new templates that have been built for System 1. So all those things will happen. They will just happen slightly later, and we'll be able to say more about when that will be once we have confirmation of the launch date of System 1. So just wanted to say that it's a big marker in the sand, and again to say a massive thank you to everybody, because we've come a long way from where we started. And I think although this provides a bit of a challenge, it also provides a bit of an opportunity for us to stop and reflect, recognise all the work that's happened, and think about what we still need to do. Martin, do you want to add anything?
Yeah, that's okay, Penny. Yeah, no, it's really helpful.
Hi, everyone. Yeah, I'm just in a church in Brighton. It's part of my spiritual restoration. But everything that Penny has said,
I think I was coming.
I would agree with.
Sorry.
Oh, sorry.
Oh, that's okay, Mark. So I think Martin was just coming in to kind of comment after Penny, but nice to see you.
But we will come back to you, Mark, because I know that we're going to kind of walk through the place updates as well. But yeah, if I could just quickly add, and obviously, you know, I think we would like to done this with our EPR, but I think it's shown kind of some flexibility, and kind of what's been really, really positive is the commitment and the actual kind of motivation for the kind of the neighbourhood teams to actually start to really work together and continue as well. And as Penny said, this is a great step forward, and hopefully this is the start of actually people feeling and experience the services different as well. So obviously we're doing a lot of system change process, but the end benefit is always for the people that are kind of accessing, who need support, and the staff are working in that way. We will kind of require a little bit more patience because we know we are going into another phase as well, but it feels really good to actually kind of be starting to achieve what we think is transformation, and that is transformation of people's experience and outcomes and how we work together in a new integrated way. So it's a really exciting day today.
Fabulous. Thanks so much, Penny and Martin. I'll stop sharing my screen so we can go to the room for any questions, any further feedback. And Mark, we can bring you in then, actually. So I'll just end slideshow and stop sharing my screen. Okay, Mark, did you want to kind of comment further about what Penny and Martin have just shared?
Yeah, well, normally everyone's used to me waffling on, so I might go against character today and just say Martin and Penny's summary I think captures exactly where we are. Everyone is very positive focused. Essentially, we effectively have kind of mobilized really everything you've heard about the EPR. The EPR is, of course, so important, and I don't want to underweight it or underestimate it. But as Martin said, there's so much, positive, constructive thinking about effectively working in our mobilised team structures. Behind the scenes to that, there's been some very positive steps of our governance meetings, including VCSE colleagues, and that will just grow and expand. I'll stop there because I think it's more important to hear what others have got to say and if there's any questions that come up. Thank you.
Fabulous. Thanks, Mark. And hi, Louise, in the background with Mark. Does anyone else have any thoughts, comments, questions in relation to the news around go live date for our neighbourhood mental health teams? Just pop your hand up and or pop something in the chat, and we'll come to you. Lucy.
Hi, everybody. This is really encouraging because obviously in my going back many years, I was within the Section 75 agreement with the integrated service. I'd really like to see a bit of joined up working because I feel like we've sort of gone down separate paths for a few years. I can see that Ray Wood is in the meeting today. I need to sing his praises because he's been instrumental in helping us convene and arrange Section 117 reviews, which is really helpful. I struggle a bit with people being discharged from 117 from the actual team and just being opened up for yearly reviews. I kind of personally struggle with that. I'd like to see a little bit more joint working. The workers that I currently work with are very efficient and very caring, but I'd like to see a little bit more joined up stuff going on.
Fabulous. Thank you so much. And for your comment around seeing someone on the call, I think these webinars are a great way to connect people to support that joined up working. And as kind of Penny said, this is the start of a journey for kind of deepening those ways of working and those relationships. So yeah, thanks, Lucy. Martin?
Yeah, I just want to pick up on Lucy's point really, because it's really important. I think the work will continue. I think now kind of, if you're thinking about a model, we describe our core team as coming together, and this is our launch pad in some ways as well. But working with adult social care, working with all those other kind of parts of the system is kind of what it's going to be in our optimization phase as well, because we know that's really important. And we're really encouraged about people's keenness to actually kind of come and support, come and join, come and work together as well. It's a really good sort of atmosphere and landscape it for us to actually start to do that for people as well. So, but thank you, Lucy. It's a really good point.
Thanks, Martin. We've got a question in the chat from Philippa. Philippa, I don't know if you want to read it out. It's about ongoing use for the primary care mental health practitioners.
Yeah. So essentially, we sit within the talking therapy service. So we use a talking therapy EPR, I suppose, PCMIS. We're due to join the NMHTs as of the 1st of January. If System 1 isn't live by then, I imagine we're no longer sitting within the talking therapy service, so we won't use PCMIS. However, PCMHPs currently also don't use care notes. We only have read-only access. People haven't been trained on care notes. They don't have the access to care notes to use that. What's the interim plan for us? What system will we be using?
Yes, I could take that if that's helpful. Thank you. And it is a really good point. And I'm saying I can take that, but I don't have the exact answer, but I will, because this is definitely on the project plan and being worked through. I'll check with my colleague Claire Newman, who is running that project. Those discussions are underway as to what that interim plan will be, because obviously we've got to, with teams, got to weigh up the pros and cons of learning one system and then another, or do you just stay on one system until the next one's ready? And that absolutely needs to be worked through, but it definitely hasn't been forgotten, and it's a really good point. I will make sure someone comes back and that people are clear about that as soon as is possible, as to not worry people, because it's a big ask, isn't it, to learn one system and then another.
And I think that's the anxiety.
Course, yeah, no, that's totally understandable. But as I say, I know it's definitely noted on the project plan, but I will follow that up.
Thank you.
Thanks, Penny. Martin.
I think it's just to acknowledge that, what's going on for that team, that particular kind of aspect of the service, and kind of going through these processes of change is really difficult. And I think we kind of really want to acknowledge that, people's professionalism and kind of commitment to kind of working this through as well. But again recognise it. Not all change is smooth and seamless as it can be kind of quite challenging and kind of anxiety provoking. So I just wanted to make sure that we did really thank that team going through this process of change.
Thanks, Martin. Do we have any other questions relating to the new timeline for neighbourhood mental health teams and the go live date? No? Okay, fabulous. I mean, you can always contact us through our email, which I'll pop in the chat. And as I say, it's an ongoing kind of piece of work, isn't it? So if you have questions at any time, then do get in touch. For the second part of the session, actually, as I said at the beginning, we really wanted to pause and take a moment to reflect on everyone's hard work to get us to this point. So I'll share my screen again, and we'll just bear with me, and I'll share my screen. Go back to the Okay, yeah, so for this part of the webinar, we're just going to recognise everyone's efforts to get us to this stage to mobilise our NMHTs. So I'm going to hand back to Penny and Martin. I don't know if there's anything else you want to say about this moment. You kind of covered that quite nicely at the beginning with just what this means and a big thank you to the teams. Is there anything additional you'd like to say?
For me, really, it's that last point. This isn't about a policy or a structure or a document. Of course, all those things are needed, but it is actually every team that we've worked with together. This has been about how they see those improvements and trying to work through those tricky things. So this is about the people in the services and the people that use our services who's really worked hard to get to a point where that experience will feel better. And although we know we've got a long way to go, that determination and that culture of openness, of becoming a bigger system, working in that way is not to be underestimated. And that for me is the biggest celebration, is everybody in Sussex who's worked on this to continue to make things better and better and better, despite all of the challenges with finances and all of the other things that the NHS is facing and voluntary sector colleagues are facing and primary care. Everybody has still come together to really focus on the most important thing, which is how can we make experience better for people who use our services, people who work in our services and the communities we serve. So it feels like a really good platform to continue with that work.
Thanks, Penny. Martin?
Yeah, I think we probably feel the next sort of 3/4 now saying thank you to people as well. But I think we really do want to say thank you to people. And I think kind of is always my mantra, I suppose, it goes beyond sort of systems and processes. It's around culture. This is about relationships. I think we're all in this environment because of our kind of passion of trying to just help and support people, but also our kind of natural ability to work together, to work in partnership, to build really strong relationships as well. And I think there's lots of benefits, as well as systems working kind of closely and effectively, is actually the power of actually somebody sitting next to each other, sitting in the same team, sharing kind of some of your headaches, sharing some of your frustrations as well, but being that kind of option and that solution for people, saying actually, well, if you thought about that, or we could do that for you, or different parts of the system could come in and actually kind of wrap around that support for people as well. That's sometimes kind of the magic that sits in kind of this new integrated working as well. So yeah, but again, if you want me to go and say thank you, I'm happy to fill the space to keep going.
Thanks, Martin. So the next kind of slide is a lovely picture of Tasha Bearfield. So many of you will know Tasha sits on the Community Mental Health Transformation Programme Board as the kind of the lead for Experts by Experience. So she works at Possibility People. Couldn't come to this webinar today, but kindly shared some words just about their input and her reflections on kind of a lived experience being really at the heart of neighbourhood mental health teams. So I'll kind of just read it out. So since 2021, people with lived and living experience of mental health challenges and their carers and families have been helping to shape the new NMHTs. through the leagues supported by Possibility and Capital. So Capital's the Expert by Experience group in West Sussex, and Possibility people are the team in East Sussex and Brighton and Hove. We've shared what matters most to us, things like feeling listened to and involved in our care decisions, not having to repeat our stories and being treated as people, not cases. We're proud that our feedback has influenced the importance of doing co-production well across all parts of the system, how communication materials are written in plain, accessible language, how people can move more smoothly between services, and how we can share our feedback meaningfully. We've also helped shape the values and principles that guide the NMHTs, making sure collaboration and inclusion are at the core. Just as important is the way we support one another. We make sure our members feel valued, heard and safe to share their experiences while reaching out to wider communities so more diverse voices can help shape change. Co-production isn't always easy, but it's how we build a system that feels joined up, compassionate and rooted in real lives. And I've had the pleasure of working with Tasha for a number of years, and her and her team of leagues and scale were just so invaluable to kind of help shape communications for the neighbourhood mental health teams. Mark, did you want to say something about Tasha and our brilliant Expert by Experience?
Well, I just want to say that what is written is real, because I've been with Tasha this morning whilst we've been looking at proposals for the health economy, essentially, in regard to future training for people, in regard to managing suicide risk across, not just for SPFT, but thinking about training models which encompass VCSE, local authority, lots of other voluntary organizations, and so Tasha is right at the heart of that. So that's what we've been looking at this morning. So that's what I'm just getting at, is that what she's written there is very much real. That's it. Thank you.
Yeah, absolutely. And we've got Ricky Perrin, who's the lead coordinator for the Lived Experience Advisory Group in East Sussex here today, and he'll be sharing a little bit about his reflections in East Sussex. But I'll move on to the next slide. So as well as our experts by experiences, GPs are a real vital part of the NMHT approach. There's some quotes on the screen, but I know we've got some GPs on the call today. I don't know, Tori Lawrence, are you there? I'd like to invite you in to talk. I know people have busy diaries. Are you there, Tori?
I'm not a GP. And I think you've got a quote from Rowan, our clinical director.
We do, yeah.
No, just to say I've been sort of involved with this since the start, and it's from when we first coordinated the mental health practitioners and mental health coordinators, and when the first model started to evolve sort of with the R's roles about 3-4 years ago. And it's been a journey and we've come a long way, but I feel like we're finally getting to sort of a proper integrated mental health system that I know sort of our practices have found very beneficial. And, we've had the model from the start, and we continue to deliver with 3 mental health coordinators and a mental health practitioner, and we'll have that as part of now the sort of wider mental health neighbourhood team.
Fabulous. Thanks, Tori. It's really encouraging to hear how these kind of foundations are kind of working in practice and already starting to make a difference. Do we have any other GPs or primary care representatives on the call that would like to share their reflections? Oh, not to worry. Let's move on, because we've got lots of people on the call. So I'll just we're going to just walk through the 3 regions across Sussex now and just get some feedback from representatives from each of these areas. So we'll go to West Sussex first. Emma, are you there?
I'm here. Hi
Hiya.
everybody. Yeah, I guess from West Sussex, I think I feel a bit lucky really because we had a bit of a head start with Pathfinder that went live about 9 years ago, which from the beginning included working with SPFT colleagues really closely. And I think having that head start enabled us to move into this sort of transformation a bit sort of fresh-headed, kind of up for it vibe. And I think seeing how well it worked with Pathfinder and now seeing it on such a wider scale is it's just so impressive. And I think it's such a been a lovely part of my career, something to be a part of. And I think, the reflections for me initially of thinking about the central team and all the expertise and experience that we bring together and the support for each other, the patience that we've had together through really, really challenging times. Penny mentioned it, financial difficulties, retendering for contracts in the VCSE, restructures, SPFT, ICB, really, really difficult times, but we've been able to keep morale and keep being really supportive of each other and push through even just the difficulties of bringing documents as one. I think I'm really proud of how we've supported each other through that. But the wider reflection for West Sussex specifically is the frontline staff. I think the actual people providing the service, that's not stopped. So all those difficult things that I've mentioned, none of the offer of help for people has stopped. We talk about go live at the moment, but I can't help but push that we've been live as NMHTs in different variations across Sussex for a really long time now. NMHT meetings, working together collaboratively to provide support together for clients and patients accessing the service. So yes, this is a really important and good milestone, but for me, it's that reflection that a lot of work has already been happening, and I'm sure we'll continue to do so. But yeah, just for me, it's a big thank you to staff that have just continued providing the care, because with financial difficulties and restructures and retendering, the pressure is there. Even if you're not giving it to staff directly, that pressure is always there. And they've just given so much and continue to give so much to the people of West Sussex. And I know that's happening across Sussex, but I'm reflecting on West today. But yeah, I think some key words that stick out are resilience, support, and just that word co-production, because obviously we spoke about it with Tasha's slides, but there's been so much input from people with lived experience, whether it is the actual clients or patients or the specific organisations leading that. But without them, we wouldn't have been able to do this. And so, just a big clap all round, really.
Brilliant. Thank you so much, Emma. It's so lovely kind of hearing your feedback, and yeah, it's been tough times, but really kind of seeing how far we've come and where we're at right now. Martin, did you have your hand up? Did you want to come in?
I moved my button. I was doing a round of applause and I did the wrong thing.
Okay. Please, if anyone wants to kind of jump in at any stage, then do so. It's a very informal session, so you don't need to wait to be brought in. Penny.
Yeah, and I think it's important to echo that, and I know you have, Emma, of course, everyone, but for BHT in particular, it was a particular challenge because it was, it took a bit of time to get things in place, and that's not been easy. So I think it's really important that part of such a crucial part of this work is the support we could give each other as systems. So in that instance, we could come together and go, okay, how can we figure it out? And how can we figure it out so things carry on and continue to work? So I just think it's really lovely to hear from Emma particularly, because it just really reflects what we're trying to do, which is that how do we bring everything we've got, whether that's a bit smaller for financial reasons or whatever, and make the very best of it. And that is actually the heart of the change. That is the change in essence. All the rest is a kind of wraparound, but for us it's saying, like, how do we get to know our local populations better, and how can we all come together with that sole interest at heart of serving those local communities? They're just really nice that it's a mixture of organisations speaking today and people to kind of mark where we've got to so far. And I agree, Emma, a lot of this is really marking the work that's happened as well as the work that's continuing.
Yeah.
Fabulous. And we also had a couple of shout outs from colleagues who work in West Sussex neighbourhood mental health teams, just really echoing what kind of Emma said about, those ways, those neighbourhood ways of working are pretty established across West Sussex. So the meetings, the partnerships with GPs, the partnership between VCSE and Sussex Partnership are really strong. So these kind of shout outs just kind of echo that. So we'll move on to East Sussex. So we've got Glenn, Ian and Ricky just representing NHS, local authority and that lived experience partnership. So I'll hand over to you three.
Yeah, thank you for that. I'll start with a quote from Shakespeare, which is, "The course of true system change never did run smooth." And I think after our initial disappointment that the system one wasn't starting, because we in East Sussex especially were pinning lots of hope on that and still are. I think we kind of regrouped as together and thought, well, actually, let's focus on everything that we can do. Rather than worrying about what isn't within our gift. And actually what we can do is an awful lot. And so we are still progressing at pace, and we are, ensuring that staff and patients are in the correct areas. We're forming our new teams. But as is been said a lot on this call, it's essentially a relationships model, isn't it? Coming together of all those different systems, and I think we were reflecting on how, yes, we weren't completely working in silos before, but I think the new structure of the new meetings has really given us that platform to come together to get the best outcomes. And we had a recent away day in Wilden where we brought together the whole of the new Wilden neighbourhood, and it was quite a large hall. It was a really well attended event from all different aspects of the neighbourhood, and I think we all came away with a real sense of optimism as about what is possible working together. We did these case studies where we looked at how each of our services, what we can offer, and I think even though we have been around and working together previously, I could see that lots of people were hearing this information perhaps for the first time, and I just think that will continue more and more, and I think you'll get better outcomes because of that. So yeah, it really is important that we take stock of how far we've come, and I think Ricky was going to reflect on one of the meetings that you were at, a neighbourhood meeting, where you can kind of you've got a really good example, Vicky.
Oh, thank you, Glenn. So for those who don't know me, my name's Ricky. I'm the facilitator of the East Sussex Lived Experience Advisory Group, and we've been plugged into this since day one, really, in East Sussex. Everything from helping design the footprints to the away days to the operational delivery groups, the provider meetings, the huddles, you name it. We rock up at as many places as we can. We get rolled out for special occasions as well, so it's all good. It's all good fun. But this week, obviously, it's impossible to go to all 5 neighbourhood meetings that are on all the time. But last week, I popped along to my first MAP meeting, which is the multi-access team meeting, and I was so impressed to see all those different clinical services in the meeting together, working together to find the right care for somebody. And they'd anonymised the client, but basically gone over some rough details on the symptoms they had. And they were like, "Oh, how can we help him?" Or "Would this be better?" Or "How long's the waiting list for this service?" And it was so nice to be in that meeting, and also to be able to go, well, did you know that in this area there's a local group, or there's a local art club, or a mental health wellbeing centre that you may be able to get that person into while they're on that waiting list? So for me, going to the huddles are great to see everyone coming together, going to the MAP meetings to see how people are starting to align their services for the benefit of the client. And it enables me to look back at some of my own mental health challenges in the past and go, that would have really helped me if I'd known about a local group, or a local men's club, or a local art group that I could have accessed while I was on that waiting list for talking therapies or some more clinical support. So, I think everyone that's worked on the Neighbourhood Mental Health Team should be very proud of themselves as to where they've got to. And even though there's a little bit of a delay, it just means you've got that little bit more time to dig back in and go back over things again before it all kicks off. So happy days. And Christmas and the New Year around the corner, bring on 2026, where we'll be smashing it next year.
When you present with Ricky, to give a football analogy, you just get the ball to him really quickly, because he's much better at this sort of thing than we are. But now the ball is going over to Ian just for a simple tap in, and Ian is going to talk about some further reflections from East Sussex colleagues.
Yeah, thanks, Glenn. Yeah, we should definitely get Ricky last. I can't really follow that, but yeah, I mean, we wanted to reflect on the journey to this point. Obviously, we were hoping we'd be sort of going fully live with EPR, and with that in mind, we'd been thinking, East Sussex ODG for a while about how's it been to get to this point, and what have we learned as a group, as a set of partners, in managing what's been such a tough journey. Emma really touched on it. The journey from when things really started back in 2019 up until today has been really, really bumpy, really rocky, but everyone has really stuck with it. So we did bring back some learning from partners that I thought might be helpful to share. And I think one of the things that we really recognised was how important it is to have lived experience input into the whole process. Ricky just talked about there around what that has looked like in East Sussex, but it's been so unbelievably valuable to have Ricky, all of the colleagues from the Lived Experience Advisory Group. Everyone's input has really, really shaped things in a way that I don't think could ever have been predicted before we started. So the value of that is immeasurable. We have had some real rocky roads in East Sussex, particularly, and it's been the case everywhere. But one thing that we've really want to take away is when we're trying to make changes, I think it's really important to get to grips with things, really start trying things out, try not to get too caught up in, what you could call analysis paralysis, really just start giving stuff a go, see how it goes. It might not be perfect when you start it, but try things out and learn and change and adapt. I think it's just being able to get going with things is the things that really makes the difference, and we've really seen that in East Sussex when we actually started putting things in place and understanding what was working and what wasn't working. It really, really got momentum going in a way that hadn't been before. So I think that was one really, really key learning that we wanted to take away and share. But yeah, people already really seeing the benefits of new relationships being formed across our 5 neighbourhoods in East Sussex. And yeah, just really, really, again, wanted to reiterate all the thanks to people on the ground that have had to endure lots of uncertainty, lots of upheaval, like Ricky and others have said, really, really continuing to do a fantastic job in amongst all of this and think about how they can do things differently. It's been incredible to see, really heartening to see. So just to really share my thanks for that.
Thank you. Thanks, Glenn, Ian and Ricky. I don't know if anyone's got their mic on. If you could just mute it, we'll just get a bit of background noise. And I will move on to Brighton and Hove. So Mark, are you still there? And Dom?
Yeah, so I would just like to actually reference what Emma said, because Emma has been very, very kind in terms of sharing her sort of, I would say, wisdom as she herself said, maybe because of the Pathfinder service, West Sussex in some respects were, a little bit ahead. And Emma's been very generous to me, because there's times when I have felt through all of these changes and difficulties, that they sometimes have felt as if they're insurmountable. But actually, Emma, the wisdom that she shared with me is around recognizing that it does take time, and you just have to be patient. She gave me loads of examples from West Sussex about how things, just their own path and their own route that they had followed. And that's actually sustained me, and it's made me, just be able to stick with it. And of course, as Ian's just been saying, really, it very much is a thank you to others. In my role, there's me, but it's also, it's every member of staff collectively, actually. And, I suppose I think of the people very close to me, the leadership team, all of the clinical leads, it's everyone. And, it's the budget today. And, to pick up Glenn's, I think quotes are a good idea sometimes because they guide us. And, the budget's live. Rachel Reeves has just said, it's not about the EPR. It is about the relationships. And I think there is some real wisdom in what she has said. And that's it. Dom, I'll open the door for you because, just in case there's anything, as usual, that I've missed that you might want to just add in.
Yeah, thanks, Mark. I'll correct you if I need to. It's been, it's been really stressful. People have been under a lot of pressure, but one thing that I think keeps me going is that hopefully once this is all live and we're all up and running with System 1 and the neighbourhood, that actually the patient experience will be a lot smoother and a lot better. And that in turn will make our job less stressful and less pressure on us because we'll have all the information we need and they won't have to, and patients won't have to keep repeating their stories over and over. But yeah, I just wanted, I know everyone in Southdown's worked really hard on this, from Ruth Cartwright to, Ra, Caroline, me, Stephanie, the frontline teams, work alongside people in SPFT and the PCNs. But yeah, I just wanted to say thank you to everyone, and hopefully this time next year we'll be smiling because it'll all be nice and smooth and it will be perfect.
That's an ambition, Dom. We've got it recorded. I'll just we did also have a couple of shout outs for Brighton and Hove in East Sussex. So one from Alison, who's the service manager for our East Neighbourhood Mental Health Team. So a shout out to the East Neighbourhood Mental Health Team for their support and feedback, which has been instrumental in setting up the new ways of working, including meeting structures, and for embracing the changes with enthusiasm and positivity. And then also one from Ra, who's head of mental health and housing support at Southdown, just saying that the mobilisations of NMHTs are an amazing cultural shift as much as a structural one. NHS and BCSE colleagues have worked hard alongside each other and people with lived experience, each bringing their expertise and deep commitment to the communities and people who use our services. Working together and developing our collaboration during the mobilisation phase has created a strong foundation which we'll build on. And she'd also like to just share a special shout out to Caroline Castle, who works at Southdown, who has worked really hard as the VCSE partner across East and Brighton and Hove. And it's a large patch to cover, a lot of meetings, and she's done a really sterling job of representing Southdown. I'll stop sharing my screen now just so I can go to the room just to see if anyone would like to share their reflections, comments, any questions from the things that you've heard. I'm opening over to you. Just pop your hand up or anything in the chat. That's okay. It's been a lot of information to take in. I know I found it just so positive to kind of hear everyone's feedback, and we have that kind of a formal go live date confirmed now for the 8th of December. I'll just, Martin, I'll bring you in.
Yeah, thank you, Alice. I think Mark just touched on the kind of word I had kind of noted for that summary, really, isn't it, about what's next, and hopefully that's really exciting. There is kind of collective responsibility to make sure that we keep developing and we keep striving for that ultimate kind of like transformation as well. But what also individually are we bringing into this space as well? What's our kind of role? And for us to really kind of sometimes challenge ourselves as well. I was really kind of mindful when I saw Claire from East Sussex pop up in front of me as well. Claire was like, had a really important role in terms of some of our early work and actually saying, well, how can we make this safe for people to go through this change, and really just held us to account and kind of sometimes challenged us as well. So we've all kind of coming from different spaces. We've all got real great skills and expertise as well. So how collectively can we kind of continue this great work? But also, what do we bring into that individual? So it's a bit of a challenge there as well. And I know people are really up for it. And I know that's going to really help us kind of move things forward in a really positive way.
Thanks, Martin. Penny.
Yeah, thank you. I just want to reiterate that and say this is a marker in the sand, as everyone's described. Everybody's doing a lot of this work. It is different to how we first planned it when we go live with the EPR. That has to be recognised. I'm really pleased we've been able to discuss that today and really check that out with teams, and that this is the beginning of a journey, and it will be gradual, and we will have to keep working and refining and working and refining. And as everyone has said, colleagues are really up for that, and they're doing that all of the time. So those meeting structures they may change a bit, but they'll stay in place in the context of bringing people together to think about how do we keep refining this and making it better and better and better. How do we work more with the emerging integrated care teams? All of these things, it's the beginning of that big opportunity. And Mark mentioned earlier about the NHS 10-year plan that really continues to focus on how do we work with neighbourhoods? How do we give really good holistic care to our neighbourhoods? So I don't want anybody to go away worrying and thinking, oh my God, there's a big launch and something completely different is going to happen, because it really isn't. But I think what we do have to really mark is the extraordinary move and the work that people have put in to really start to work and form relationships and work in this very different way. What will come next will bring back to a webinar like this the other things we still need to do, so to help with that optimization and the plans that we'll get from speaking to many people on this call and people around the system, and then we'll prioritize those and think about, okay, where do we go to next? And of course, that will now include the electronic patient record and anything else we might need to do with that, and how, you know, what's the impact, etc., etc. And it is different in different areas. But as everyone said, for now, today was really about saying, my goodness, huge thank you to everyone who's just worked so hard to bring about those changes, set up those new meetings, think about those cultural changes, despite all of the challenges. And it's not to sweep those challenges under the carpet. We will have to continue to work those through. But brilliant. And again, I just final thanks from me, from a central team perspective. It's been fantastic working with everybody.
Thank you. And thanks to everyone who's kind of contributed to this session. Just to kind of remind that our next, Emma.
I was going to put in the chat, and I thought I'm just going to say it. A big thank you to Penny, because she's kept everyone together through different organisations and different challenges, and you've always been our sort of go-to to keep our heads straight and together, and you're always really supportive. So just a big thank you to you as well.
Oh, totally. I can imagine I speak for all of us. We definitely echo that. Yeah, so I'll call the kind of session to an end, but just big thank you to everyone that came along, contributed. It's actually been really kind of inspiring and positive to kind of listen to everyone talking. Our next newsletter goes out on the 8th of December to mark go live. So if you haven't already, then do sign up and you get that straight to your inbox. I'll pop the registration link in the chat. And our next webinar won't be till January now. So we're going to take a month off in December. So people can celebrate. And yeah, we'll be back in 28th of January, 12 till 1. But yeah, have a great rest of the day. Lovely to see you all. Take care. Bye.
Thank you. Bye.